Imagine this. You wake in the middle of the night because your knee is throbbing, hot, and twice its usual size. Or maybe your shoulder pain only hits when you're resting quietly on the couch after dinner. In the next few minutes, I'll walk you through 5 science-backed joint pain red flags people often shrug off, signals that deserve a real check-in so you can protect your mobility, your independence, and the moments that actually make life good. Let's start with the kind of change you can feel and see. When a single joint suddenly gets very swollen, warm to the touch, stiff and painful, and you also feel feverish or generally unwell, that is not a wait and see for a weak situation. Clinicians worry about infection inside the joint because bacteria and inflammation can damage cartilage quickly. This picture often shows up in the knee, hip, shoulder, or a small joint in the hand. People sometimes try to tough it out with ice packs and extra painkillers, but that only delays the care that protects the joint. What helps right now is recognizing urgency. Intense pain plus heat, plus swelling in one joint, especially with fever, should be checked the same day. If you've had a recent cut, injection, procedure, or a skin infection near that joint, mention it. If you use immune-suppressing medicines or have diabetes, your threshold to seek help should be even lower. Avoid taking leftover antibiotics. They can blur the clinical picture without solving the problem. If you can, jot down when the swelling started, whether you can bear weight or use the joint at all, and whether you've had chills, small details that help the clinician move faster. Timing tells a story too. Pain that wakes you at night or keeps hurting even when you're completely still is a clinical red flag because it often means the joint is irritated beyond everyday wear and tear. Think of it like a smoke alarm that only goes off when the house is quiet. People will say, "It's fine during the day, it just kills me at 2 a.m." Or, "When I finally sit down, the ache lights up." That pattern deserves attention. The goal isn't to panic about worst-case scenarios. It's to respect the message your body is sending. If sleep is being interrupted several nights in a row by the same joint, or if you feel a steady nagging pain while resting, track the pattern for a few days and book an evaluation. Write down the exact times it wakes you, how long it lasts, what helps, and whether there's any swelling or warmth. Night or rest pain doesn't always mean something dramatic, but it's one of those clues clinicians don't want you to ignore. Here's another pattern many people chalk up to just getting older, but it actually points to inflammation, morning stiffness that lasts a long time, half an hour, sometimes longer, especially if it eases as you start moving. Duration matters. The brief, rusty feeling that melts in 5 to 10 minutes after a big gardening day is common. What's more concerning is the kind of stiffness that leaves you feeling stuck for most of your first hour, particularly in both hands, wrists, or feet. Some people notice rings won't go on in the morning or shoes feel tight until late morning. Tracking this for a week helps a lot. Note the start time, how long it takes to loosen up, and which joints feel puffy or tender. Early evaluation is worth it because inflammatory conditions respond best when addressed sooner, and even if it isn't an autoimmune issue, you'll get a plan that preserves function and reduces pain. Next, think about what happens after an injury. Rapid swelling, the sense that the joint is giving way, an inability to bear weight, or a mechanical block that stops movement are all signals to get checked promptly rather than pushing through. Picture a knee that balloons within minutes of a misstep, or an ankle that refuses to carry your weight after a twist, or imagine a knee that locks so you can't fully bend or straighten it, or catches with sharp pain when you try to pivot. Those mechanical signs can mean something structural, like a torn meniscus, a ligament injury, or a fracture, needs a closer look. The smartest move is to protect the joint early, keep weight off it, use a simple compression wrap, elevate, and apply cool compresses for short intervals. What you want to avoid is the "I'll test it with a 5-kilometer walk" mindset that turns a short rehab into a long one. If you can't take 4 steps without limping or the joint feels unstable, that's evaluation time. Finally, watch the skin over and around a painful joint. Expanding redness, especially when paired with fever, chills, or feeling ill, can signal a skin or soft tissue infection that needs timely treatment, and sometimes it overlaps with deeper problems around the joint. A simple at-home trick helps you communicate clearly. Draw a pen line around the border of the redness and note the time. If the redness spreads beyond the line over a few hours, you have objective proof it's progressing. Avoid hot packs on red, tender skin. Warmth can make inflammation worse. Rest, elevate the area if possible, and seek care the same day, particularly if you're immunocompromised, have diabetes, or if the redness is on the lower leg and marching toward the knee or ankle. Let's translate those ideas into concrete what to look for and what to do, one by one, because small steps right now make a real difference later. With a hot, very swollen single joint plus fever or chills, prioritize same-day evaluation. While you're arranging care, minimize food and drink in case a procedure is needed, and keep the joint relatively still. Don't apply tight wraps that could cut circulation, and don't take someone else's antibiotics. If you're caring for someone who can't describe their symptoms well, use touch. Compare the affected joint to the other side. If it's clearly warmer and the person resists even gentle movement, treat that as urgent. For night or rest pain, respect the pattern. Keep a simple log for 7 days. In your phone notes, write night wake-ups, the times they happen, how long the pain lasts, and what you tried. Position change, pillow support, cold pack, gentle stretch, and whether it helped. Note whether the joint looks normal in the morning or if it's puffy. Bring that log to the appointment. It saves time and narrows the differential. If the pain is steadily worsening or you're losing sleep multiple nights in a row, book the evaluation sooner rather than later. For long morning stiffness, consistency of the picture matters more than any single day. Track which joints feel puffy, whether both sides are involved, and how long it takes to loosen. Pay attention to associated signs: low-grade fatigue, low appetite, low mood, or occasional low-grade fevers. None of these alone proves anything, but together they steer the conversation. Gentle movement early can help. Think 5 minutes of easy range of motion for the affected joints, warm water on the hands, or a brief warm shower, but avoid heavy loading first thing if mornings are when you're stiffest. For rapid swelling after an injury or a joint that locks or gives way, the plan is protect, assess, and then progress. Protect the joint with a brace or wrap if you have one, but don't cinch it so tight your fingers or toes tingle. Use a cane or crutches if bearing weight is painful. There's no prize for limping proudly. Cool the area for 10 to 15 minutes at a time, a few times per day, and keep the limb elevated when you can. If there's obvious deformity, numbness, or you can't move the joint at all, seek urgent care. Otherwise, schedule an evaluation promptly and skip the stress test activities until you've got guidance. For spreading redness over a painful area, mark the borders and watch the clock. If you're safe at home for a few hours, elevate the limb and rest. If the redness advances or you develop fever or chills, that's the go now moment. Don't try to sweat it out or mask it with multiple doses of painkillers. And if there's a wound nearby, an insect bite, a cracked heel, a hangnail, point it out during the visit. A few common missteps deserve a spotlight because avoiding them can save you days or weeks. 1. Icing a hot, feverish joint for days while hoping it settles. If infection is in play, time is cartilage. 2. Blaming months of long morning stiffness on just age and waiting for it to pass. Normal stiffness after activity is brief. The long daily thaw deserves a look. 3. Masking night pain with alcohol or extra sleep meds. You might knock yourself out, but the joint is still asking for help. 4. Testing a swollen, unstable joint with a big hike or heavy chores because you don't want to lose fitness. You won't lose fitness in a few days of smart protection. You can lose stability if you push a fresh injury too soon. Let's put all of this into a simple 3-step action plan you can use the minute this video ends. Step 1. Track. 7 days of real data beats 7 months of guesswork. Use your phone to note when the pain happens, where exactly it sits, point with a fingertip, how long it lasts, how intense it feels on a 0 to 10 scale, and what makes it better or worse. Take quick photos of visible swelling in good lighting. Compare morning and evening. If stairs, chairs, or jars are part of the story, write that down too. Step 2. Adjust one habit today that reduces load without total rest. Swap a long walk for 2 shorter ones. Use a handrail on stairs. Break heavy grocery loads into smaller trips or use a backpack. Add 5 minutes twice per day of gentle range of motion for the affected joint, staying under a pain level of 3 out of 10. Replace long, static stretches with short, comfortable movement that coaxes the joint rather than forcing it. Step 3. Escalate care appropriately. If you notice any of the 5 red flags, especially a hot, swollen joint with fever, spreading redness with chills, night or rest pain that keeps waking you, long morning stiffness, or rapid swelling with inability to bear weight, book a clinical evaluation now instead of when it's convenient. Clinicians would rather see you early than late, and catching problems sooner almost always means simpler care, shorter recovery, and better long-term function. A few nuances help you avoid false alarms while still catching the important stuff. Not every stiff morning is inflammation. After a day of unusual activity, moving furniture, pulling weeds, a long drive, brief stiffness that loosens in minutes can be normal. That said, if it's there most days for weeks and takes a long time to fade, it's worth a conversation. Not every red patch is a dangerous infection. Contact irritation or a bug bite can look similar, but those usually don't come with fever, chills, or rapid spread. If you remove the trigger and rinse the skin, minor irritation often improves within a day. And not every swollen joint after activity means you tore something. Some swelling builds gradually after extra load and settles with a few days of load management and gentle movement. What shifts the decision is the combination of clues: rapid ballooning, inability to bear weight, mechanical locking, or giving way all raise the stakes. Because we naturally minimize symptoms, it helps to rehearse in your mind what you'll do if one of these patterns shows up. If your knee becomes hot and swollen and you feel ill, you'll set aside the rest of your day to get evaluated, period. If your shoulder wakes you night after night, you'll keep a clean log for a week and call. If your hands take an hour to loosen every morning, you'll stop blaming age, write down the details, and book with your clinician. If your ankle swells fast and won't carry you, you'll protect it, avoid testing, and get it checked. If redness is spreading across your lower leg and you have chills, you'll mark the border and go the same day. Deciding this ahead of time turns "I'll think about it" into "I know what to do." Let's also talk about load, posture, and tiny daily choices that either calm a joint or keep it irritated. Joints love movement, but they hate sudden spikes. If weekends are your only exercise days, your knees will notice the jump from 0 to hero. Break up loads through the day and week. Switch repeated deep squats for hip hinge movements with a neutral spine when you lift. Use both hands for heavier tasks. Rotate chores. Don't scrub a whole floor in one go if your wrists are flaring. If you work at a desk, schedule micro-movement breaks every 30 to 45 minutes to keep hips, knees, and back from stiffening. Sleep position matters for shoulders and hips. A small pillow between the knees can reduce hip pressure when you lie on your side, and a rolled towel supporting the arm can quiet a grumpy shoulder. These are not cures, but they're friction removers that help calm a joint while you get the right diagnosis and plan. Pain language can be confusing, so here's a quick way to describe what you feel. Location: fingertip, small, a point, coin-sized, palm-sized, or whole joint. Quality: sharp, dull, throbbing, burning, or deep ache. Timing: constant waves or only with certain moves. Triggers: stairs, first steps in the morning, after sitting at night, with cold, with heat. Response: what actually helps? Movement, rest, cool, warmth, support, a brief walk? This pain profile turns vague descriptions into actionable clues. Now, a rapid-fire recap you can repeat to yourself later. 1. A single joint that becomes hot, very swollen, and hard to move, especially if you have fever or feel ill, needs same-day care. 2. Pain that wakes you at night or persists when you're at rest is a "don't ignore it" signal. Track and get it checked. 3. Morning stiffness that lasts 30 to 60 minutes or more, especially in multiple small joints, points toward inflammation. Early attention helps. 4. Rapid swelling after an injury, inability to bear weight, giving way, or mechanical locking means protect it now and get evaluated. 5. Joint pain with spreading redness plus chills or fever deserves prompt treatment. Mark the border and seek care. If this helped, tell me in the comments which sign you've seen in yourself or someone close to you. Share this with someone 50+ who keeps walking it off, and subscribe for the upcoming videos on building bone strength after 50 and stopping night cramps from wrecking your sleep. Final note before you go. This content is educational and meant to guide smart decisions, not to replace an in-person evaluation. If any of the red flags sounded familiar, especially the urgent ones, please speak with your doctor.